Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Sometimes people with intellectual and developmental disabilities communicate in ways other than using words. Many times they communicate through behaviors. And sometimes these behaviors can be indicative of an underlying medical condition rather than it being some medical condition or just some adverse behavior that's a result of them having a disability. So we're going to talk about some specific behaviors that could point to some underlying conditions. So one of the things I want to talk about is hand-mouth behavior. You may have seen this in people with disabilities. They sometimes may put their hands in their mouth. They may be almost gagging themselves. They may put other objects in their mouth, such as a sock or some object off of the floor. When people eat things of non-nutritional value, we call that a pica behavior. And anytime you see this type of behavior, hand-mouthing, putting things in their mouth on a regular basis, that can indicate something that we don't often think of, which is gastroesophageal reflux disease. And the reason a person might be putting their hand in their mouth is because they might be trying to stimulate salivation. And when we swallow saliva, it washes that acid down, which is causing the discomfort and the pain. Or maybe they're trying to reach for the pain or to get at the pain, similar to a way that if we bump our arm, we hold our arm. Or if we swallow something and it went down and it hurts, we might grab our throat. So the person with a disability may not be putting their hand in their mouth or eating objects only because that's what they do, which is often what we think about. We call that diagnostic overshadowing, when we attribute things to the person's disability rather than looking at other potential causes. So we should be thinking about the possibility of an underlying gastroesophageal reflux problem. Sometimes it could be some other oral problem, oral pain, a sore throat, but look for something that is in the oral or gastroesophageal reflux area when a person uses hand-mouth behavior or puts things in their mouth. Sometimes also, if people get physically aggressive around mealtime or right after mealtime, that could be a way that they're expressing that they're having discomfort, that they're having pain from reflux. So, we know that if we eat a big meal, we might feel reflux, this acidic reflux come up. And if we learn that every time I eat, I'm going to have this pain, then I may become aggressive. I may become resistant if I can't tell someone what's going on. The same thing when food is presented to us. If we know that, every time that food is presented to me, I'm going to end up having reflux and heartburn, I might become aggressive, or I might become resistant, or I might not want to eat. So those are behaviors that could point to an underlying gastroesophageal reflux condition. So we're going to talk about a number of other behaviors that can point to specific medical conditions like this in upcoming episodes. So stay tuned. Many of the topics that you hear on Medical Mondays comes from the book Clinical Pearls in IDD Healthcare. It's a great resource guide that provides helpful clinical information to anyone who provides support for people with intellectual and developmental disabilities. This includes family members, direct support professionals, nurses, physicians, and others who work in the field. You can find it at replacingrisk.com. That's replacingrisk.com in our store.